Good morning, everyone. Thanks for joining. I am so pleased to introduce Dr. Karina Espana, who is one of our current Chief Child and Adolescent Psychiatry Fellows. She obtained her undergraduate degree at Portland State University, medical degree at Oregon Health and Science University. She was an APA SAMHSA Minority Fellow and this year's recipient of the Greenblatt Fellowship Award. She has a longstanding interest in community mental health, healthcare and equities, crisis response and intervention. She is committed to examining services and interventions for high-risk youth, particularly those with histories of trauma, system involvement, such as foster care and juvenile justice. And her current body of scholarly work includes considerations of narrative-based interventions for high-risk youth. She will be completing a forensic fellowship, so we will be bidding her farewell. But as a colleague, she's been really amazing to work with and really inspiring and really trying to open up new frontiers in our clinical armamentarium by thinking about narrative therapy, comic book interventions. And so I'm really pleased to have been on her mentoring team and part of her journey. And with that, I will let you begin your grand rounds that we've been all dying to hear.
Great, thank you so much. Let me share my screen. All right, well, hi everyone. Thank you so much for joining this morning. I am just so thrilled to be here with you to discuss today's topic, this grand rounds. It's titled Reimagining Trauma-Informed Narrative Building Through Comics. I have no conflict of interest to disclose. Before I proceed though, I want to position myself in this work and acknowledge my positionality and how this has influenced my lens on this subject. A little bit about myself is that I was raised in the Pacific Northwest in a predominantly white suburb in Southwest Washington. I identify as multiracial. My father was Chicano and Native American. My mom immigrated from Scotland. I am cisgender, heterosexual. I speak English, and I come from a family that has strong ties to community service that includes education, community development for minoritized communities, and law enforcement. I am deeply committed to social justice. I have professional experiences in considering equity in systems of care, particularly around crisis intervention, social services, medical education, hospital administration, care delivery. I truly believe that each one of us has responsibility to dismantling oppressive systems of power and returning authorships to where they belong. I am very passionate about invoking cultural identity into narratives, and both personal and professional, and my primary interests are in exploring and supporting the narratives of youth involved in the juvenile legal system and child welfare, really aiming to promote their own authorships. This lens has informed my work in partnering with a community-based organization to develop a narrative-based program for system-impacted youth and young adults utilizing comics. A little bit about what we're going to be doing today is that we are going to be defining narrative-based therapies and art-based interventions and their utility for youth with mental illness. We will identify common themes of internalized narratives for justice-involved youth and approaches to consider in narrative therapy. We're going to describe the field of graphic medicine and its intersection with psychiatry. And we're going to consider the prospective use of comics in therapeutic settings through various applications. So how are we going to do this? So we're going to come back to this graphic quite a bit during this presentation, but we are going to first review the role of narrative-based therapies with an added focus of looking at the role of interventions in justice-involved youth. Then we're going to go to looking at art-based interventions. Both of these together are going to set up the stage to discuss comics. Comics being a language or a medium to convey information to its viewers, perhaps as an intersection of both narrative and art. This is going to guide us then to a discussion of the field of graphic medicine, how this currently looks in psychiatry, and then we're going to look at, well, what do we do with all this? Where does this take us into the future of how we think about narrative-based interventions and the comics medium format? Before we do this, I want to tell you, a lot of people ask me, like, why this? Why now? So I want to touch on my why for this subject. I have a longstanding belief in the magic of storytelling, being influenced by the storytellers in my life. My mom was an elementary teacher who taught kids the power behind the pen and remains an avid writer. And my father was a community organizer, a meaning maker, a man with a vision for minoritized communities who really leaned into the stories of others to develop a vision of a more equitable, community-driven solutions. So culturally, it's significant to tell stories to make meaning of one's life and those that came before us. Now, as a child, I loved manga. I loved drawing, particularly Sailor Moon, and this pictured here is Sailor Jupiter, who was my favorite character. I loved video games, particularly role-playing games. I simply just loved immersing myself in a world where I could envision myself as other characters. I could see myself reflected in sort of these fantasy-based stories. And we meet youth all the time that love manga too. And I would encourage you to ask them about it, find out what they like, what they relate to about what they're reading. And yet, as I entered the world of medicine as an adult, it meant initially leaning into a world that has parameters of how we as providers come to know our patients and their needs and what we do about that. And it often seemed that comics just didn't have a place in an academic environment. And whatever I did read, it seemed as if people weren't really quite sure what to make of comics. And so they really were these two distinct, separate worlds. So my personal interest became very separate from my professional identity. And yet, when I was reading in comics, so much of what is written is really thoughtful, it's quite insightful, and it's quite informed. The reality is that healthcare systems hold the power over narratives, and the risk of this is really great. It creates ample opportunity for us to become quite misattuned to our community's needs. And so, as I think about it, joining with my patients through how they tell their stories has been one of the greatest privileges of my work. And so with this, I ask all of us to step outside of the predefined notions of how a narrative is told in medicine. Now, we aren't the authors of the stories of our patients. So how do these authors, our patients, want to tell the stories of their lives? And how do we, as the authors of our own, wish to tell ours? So I'd like us to consider a different medium today, being comics, as having promising opportunity. So here's that image again. We're going to start first by talking about narrative-based therapies. So it is embedded in our existence to naturally want to create meaning of life through the stories we experience and tell. The use of narrative is a central tenet to many different therapeutic interventions within our field. We're just going to touch on just a few of these, but one is narrative therapy, the other is narrative exposure therapy, and also trauma-focused CBT. And then we're going to look at the evidence for these interventions. So narrative therapy, this is, I think, a beautiful quote that kind of is a helpful synopsis, but it seeks to be a respectful, non-blaming approach to counseling and community work, which centers people as the experts in their own lives. It views problems as separate from people and assumes people have many skills, competencies, beliefs, values, commitments, and abilities that will assist them to reduce the influence of problems in their lives. This therapy was originally developed in the 1980s, and it really describes that our identities and the experiences of the world are shaped by stories internalized from our lived experiences. It's the idea that people have interacting narratives that contribute to their sense of self. And these narratives are really heavily influenced by social, cultural, and political context. And it's important to recognize that there's a tendency to have really problem-saturated stories. And so narrative therapy really emphasizes the value of separating our identities from our problems in order to resist the influences of those problem-saturated stories and what can be very deficit-oriented descriptions. It uses a type of therapeutic questioning, and it also acknowledges that people possess unique skills to improve their lives. And the patient and the therapist collaborate to discover so many possibilities about new storylines, new individual abilities to reauthor these stories. And we've seen this applied in children, adults, as well as family settings. Narrative exposure therapy is an evidence-based treatment for youth and adults with PTSD, particularly complex and multiple traumas. The idea here is that the therapist works with the patient to establish a chronological narrative that incorporates both traumatic experiences and also some of the positive events to help contextualize that network for cognitive, affective, sensory memories of a patient's trauma. And by engaging in a narration of the whole story, the person doesn't have to choose just one traumatic event. Rather, they can kind of reflect on their entire life, and it helps with creating and cultivating personal identity. And it really helps take what can be a very fractured and fragmented narrative to build it into a more coherent narrative. And, you know, the important thing is that this process really helps recapture the patient's self-respect, acknowledges their human rights. And for many, it can be very empowering knowing that they are going to be receiving sort of a written biography at the end of treatment. And that can be certainly an incentive for completing treatment. Trauma-focused CBT is a well-established intervention for youth, and trauma-focused CBT addresses multiple domains of trauma impact: PTSD, depression, anxiety, externalizing behaviors, relationships and attachment challenges, school and cognitive problems. And there are 9 components as seen here in the visual from Musk, but one aspect is the trauma narrative. And the trauma narrative is a central tenet of trauma-focused CBT, where the patient is creating a narrative of the traumatic event that helps expose them to painful memories, thoughts, feelings, and what should be a very safe and therapeutic environment. And so one of the goals here is to unlink those thoughts and reminders from the very overwhelming and negative emotions. The trauma narrative can actually also support the patient in really trying to incorporate this event into their full life history to move forward. So what do we make of this? Like, that was just kind of a brief overview, but let's look at the evidence base for some of these interventions. So there are identified applications to social and emotional skill development in children. There was data collected from 353 children over 2 years who received narrative-based interventions, and that they showed significant improvement in self-awareness, self-management, social awareness, empathy, and responsible decision-making. In another study, looking at the use of the trauma narrative, there was 70 African-American children ages 6 to 12 were randomly assigned after Hurricane Katrina to look at a type of grief and trauma intervention after the disaster that compared coping skills and trauma narrative processing compared to coping skills only. And both treatment groups showed considerable improvement in distress-related symptoms and social support. But it was notable that the highly distressed children may have experienced more symptom relief with coping skills with narrative processing than with just coping skills alone. There was another study that randomized 210 children, 4 to 11 years old, in trauma-focused CBT groups to treatment that included 8 weeks and 16 weeks with and without a trauma narrative. Overall, results suggested that trauma-focused CBT was effective with or without the trauma narrative, regardless of the number of sessions. But the trauma narrative component was actually found to be most effective and efficient means of kind of ameliorating specific abuse related distress and related fear and general anxiety. And lastly, we also know that trauma-focused CBT has significant evidence for working in transition age youth for folks with PTSD. Now, my interest is really in thinking about these applications towards system impacted youth. And so let's take a look at how we might consider applying this here. So youth involved in the juvenile justice system have a substantially higher prevalence of psychiatric disorders compared to the general population. That includes psychosis, major depression, ADHD, conduct disorders, PTSD. And in a systematic review, the prevalence of trauma exposure was as high as 84% of female justice-involved youth, and PTSD prevalence as high as 48.9%. And a recent study revealed that many psychiatric disorders extend beyond adolescence and really can complicate that transition from adolescent to adulthood. So with this, we think, well, hey, I think there's an opportunity to consider narrative-based interventions in this population diagnostically. Now, I also was interested in, well, is there any evidence for applying these interventions in folks with a history of commercial sexual exploitation in the treatment of PTSD? And there was a very small, limited retrospective study that looked at the results of using narrative exposure therapy to treat 10 women who had been sexually exploited and had been diagnosed with PTSD. And there had been improvement in PTSD severity and improvement at follow-up 3 months later. And we also have some great literature that talks about how to use these interventions in these populations more specifically, and I've included the citation here. So there is existing literature that considers how the dominant stories and the narratives of justice-involved youth and how these may develop and approaches to consider in narrative therapy. Now, there's this typical assumption that we choose the narratives that we come to develop and hold. But those narratives are so strongly influenced by our circumstances. And it also includes the stories that others may hold about them. So example might be that a child can be influenced by their parents, their teachers, social workers, police, and other professionals. How do I consider, like, the concept I'm hoping to impress upon you is how we conceptualize what is narrative development. So we can think of narrative in kind of two categories. There's content and meaning, and then there's narrative as being a skill. And so approaches from narrative therapy can be help in helping youth create more constructive stories about their lives. And that really gets at that content and meaning. But there also is a skill piece of writing a narrative. And that really weaves in important concepts from attachment theory and from kind of neurological basis of how we structure stories and structure the story of our lives. And so I want to focus just spend a little bit more time on this thinking of narrative as skill, because I don't feel like this is often discussed. And it really impresses upon that not only is the content important, but there is also an importance to just the ability to be able to create a story in a coherent narrative. So there's a neurological development aspect to it. It requires practice, it requires encouragement, it requires a conducive learning environment. This often comes from practice with parents who might provide that emotional scaffolding for one's experiences and feelings. And if we think about it, at an early age, stories are often concrete, immediate, and episodic. And really developing more sophisticated stories starts around adolescence. But a coherent narrative involves setting the story in context, involves making connections to events. There's a cultural awareness, there's sort of a reflection and evaluation capacity, there's a sense of purpose. And there's also a reference to maybe what are cultural norms, what is normative development, what are expectations, what marks transition from childhood to adulthood. And the ability to connect these events really requires a skill to be able to think about other people's intentions and internal states, to stand outside our stories, reflect on maybe inconsistencies and gaps. But the reality is that to do so requires a safe and secure environment for reflection. If that environment is chaotic or dangerous, the child's thinking is often overtaken by the priority of just ensuring their own safety. And so I invite you to consider some of the narratives that maybe of youth that you've worked with who've been involved in the system. What might a justice involved youth, what might they say about themselves? Maybe it might be, I'm not good enough, I'm bad, I can't control my anger, I can't be trusted. What might they say about their life? I've seen a lot, I don't have anyone in my life I can rely on. I have no life ahead of me, I hate school, I was abandoned. And what might their narrative say about others is that, gosh, I can't trust anyone except maybe a few of my close friends. My parents don't care about me. Social workers, police, psychologists, psychiatrists, they all tell you just what to do. And psychiatrists just tell me I have mental problems. And the reality is that when we think about narrative therapy, it's not just sort of a body of techniques, it's rather an orientation that's meant to be very empowering and non-expert. And so the fundamental view, though, is that we live in and through these stories that we hold about our lives and ourselves. For the sake of time, I won't go into this in too much depth, but this is a graphic that basically talks about how we might consider promoting both content and skill when working with justice-involved youth and applying narrative therapy. And it involves these different aspects, right? How do we create a secure base in therapy? How do we help create a scaffolding in forming a narrative for youth who might have difficulty in that skill? So scaffolding, modeling, providing visual aids. How might we explore narratives? Right? There's some interesting ideas about how to do this, right? And sometimes that can involve music, TV, making connections to other people, how we might inquire about what one's thinking and feeling as we're telling a narrative. And the movement to an alternative narrative is really actually quite challenging. It's quite an undertaking. But what I want you to take away from this is that there can be a labeling of justice-involved youth as being a threat to security, a threat to families, their communities, their society, alongside these stories of lived rejection, abuse, humiliation, neglect, violence, and failure. And so for those who really quite courageously started this process, we as therapists have this opportunity to help them develop, reflect, and contemplate alternatives. And that's a skill that really needs to be nurtured. And along with that validation of their experiences, therapists can really help them with seeing themselves in a new way. Very briefly, we're going to shift to art-based therapies. Remember, our discussion alongside narrative is going to kind of set the stage for when we look at comics coming up shortly. So this is a broad overview of art-based therapy. So art therapy is an integrative mental health and human services profession that enriches the lives of individuals, families, and communities through active art making, creative process, applied psychological theory, and human experience with a therapeutic relationship. And there's also a lot of discourse about how visual art has been kind of considered sort of a depiction of abstract internal states. We have some evidence that supports the use of art therapies being a way to provide a non-invasive therapeutic space for young children to work through and process their fears, trauma, and difficulties. And there was a study of 142 individuals ages 13 to 18 with PTSD in New York that looked at trauma-focused art therapy protocol versus treatment as usual, and found that the art therapy protocol was superior for PTSD symptom reduction. All right, now we're going to be talking a bit more about comics. And so here we are in this graphic right in the middle. We're gonna look at how comics are really quite a unique medium. There's both history and properties of comics that make them fascinating to its audience, and really extremely rich to interrogating the human experience and considering their function and narrative. So let's review those. Scott McCloud, he is an American cartoonist and a comics theorist, and he has defined comics as juxtaposed pictorial and other images in deliberate sequence intended to convey information and or to produce an aesthetic response in the viewer. And there's so many different definitions of comics. This is probably felt to be the best approximation of how we might describe comics. There is a lot of discussion about when comics began. The reality is that we've seen images represent story for hundreds of years. And comics themselves have existed since the end of the 19th century, but really expanded most notably during the Golden Age, and that was in 1938 to 1956. That really introduced the superhero archetype. So that's brought us some of our very well-known characters like Batman, Robin, the Flash, the Green Lantern, Aquaman, Captain America, Superman, Wonder Woman. And in 1954, a psychiatrist really triggered a lot of moral panic over comics, thinking that comics were a cause of juvenile delinquency. And that led to the establishment of the Comics Code Authority, which tried to regulate the representation of violence, horror, gore, and it banned comments about and content about racial and religious prejudice. And so this led also to a reduction in non-white characters, and there was less independence seen of its female characters. And I think it's worth noticing that psychiatrists have had very few positive portrayals in the comic book universe. And it's been suspected that this psychiatrist, his efforts might have been contributory to this. Now, we also see through the Silver Age, that's where we began to see the Fantastic Four and Spider-Man and Justice League, X-Men. In the Bronze Age, it was interesting. In the Bronze Age, this Comics Code Authority became less important. So it was actually broken in 1970 when the US Department of Health, Education, and Welfare actually requested that Marvel publish a Spider-Man comic that dealt with the issue of substance use. And this was a bestseller. At this point in time, you began to see more diversity in characters, more characters of color. You still saw the perpetuation of racist stereotypes, but there was sort of an added sharp social edge that began to explore prejudice and bigotry. And in the modern age of comics books, this is considered starting in about 1985 to now, we've just seen this incredible expansion of storytelling. And we see more opportunities for underrepresented and minoritized voices to begin their storytelling through comics. And so some examples of comics from this time would be things like Batman, The Dark Knight Returns, as well as Watchmen. And I just want to point out that there's this very traditional way of thinking that great works of art and literature really must be kept separate. We have many children's books that have pictures and few words, but those pictures become fewer and fewer and fewer as we get older. And there's kind of this attitude that pairing pictures with text can be too simplistic, and this attitude can be very pervasive. But I really want to make the case that powerful storytelling can really happen through comics. Now, I want to just make note of what makes comics very unique and kind of how a reader interacts with them. So the invention of being able to print comics really created opportunity for this art form to really become enjoyed by everyone. And what's great about that is that humans, as they interact with comics, it now is reaching more people. And so humans are a self-centered race. We see ourselves depicted in everything, and we can assign entities and emotions where none exist. Comics really utilize the propensity for the brain to create narrative and meaning. So when there are two images side by side, the brain automatically assigns a sequence. And each panel represents an identified story or a beat, which can be kind of one moment in her look or establishing shots, just kind of this moment in time. And you know, Scott McCloud defines the word icon as any image that is used to represent a person, place, thing, or idea. And so comic images work as icons. So figures and faces are often an oversimplification of reality, but we will read them as real events happening to real people. And you know, it's interesting because these icons actually, as Scott McCloud says it becomes a vacuum into which our identity and our awareness are pulled. We don't just observe the cartoon, we become it. And so all of us will make partial and incomplete perceptions of the world around us through our senses to kind of perceive the world as whole. That's what we naturally do. And in comics, that process is called closure. It's natural, it's essential. It's just how we all relate to and recognize others and make interpretations about the world. Now, the space between the panels, so you'll see the panels represented by the squares, the space between the panels is what's called a gutter. And the gutter is a critical aspect between the creator of the story and the audience. And it's thought that there's sort of this complicit relationship between the reader and the author, which is what makes this quite powerful, is that you're seeing these moments represented in time, these beats represented in panels, but the gutter is where you're assigning sequence and assigning meaning and assigning interpretation as well. And so, you know, the comic kind of gives a continuous reading experience so that it sort of feels like living. And a comic isn't about just the visuals or just the words. It's really about this strategic interplay between both of them. Okay, so what have we done so far? We have outlined narrative and art-based interventions to set the stage for looking at comics. We talked a little bit about the history of comics and also some of the unique properties of comics. And now let's look at medicine and how we have leaned into utilizing comics through the field of graphic medicine. So graphic medicine is called the intersection of the medium of comics and the discourse of healthcare. And it is first coined by Dr. Ian Williams in 2007. And what it does is it really invokes the sort of the visual art of comics in combinations with the principles of narrative medicine using the visual systems of comic art. And what's really interesting about that is it's able to sort of integrate the physical and emotional signs and symptoms of illness within a medium. There's a lot of recent scholarship around comic books as having some promising opportunity and being able to build a more inclusive perspective on medicine, on illness, on disability, on social justice and equity and health disparities. And there are fantastic books in all of these different areas. There's this book called Graphic Medicine Manifesto, and that really encompasses a more detailed exploration of this field. What I also really appreciate that graphic medicine kind of rejects the notion of the universal patient. Rather, it aims to be very inclusive of varying perspectives and experiences. And as this book describes, it vividly represents multiple subjects with valid and at times conflicting points of view and experiences. In addition, there is ongoing academic exploration of the use of comics, and comic studies has become its own area of academic scholarship, and especially through the 80s, through the 2000s, you know, we still see that comics are trying to sort of justify their legitimacy and its identity because of this cultural perception I've described to you about it being in some way of a devalued status. As in academics, we're trained to think within sort of very established ways, right? We have we write for other academics, we write for other disciplines. But the reality is that one of the most exciting things about comics is that it has the potential to speak both within academics, but also beyond any one audience. The comics medium for storytelling and for health has existed for several decades, and autobiographical comics have really overturned what can be a very at times glamorous views of superheroes, but we now see this really alternative and what they call like unglamorous view that maybe makes these experiences more relatable and more inclusive. There are a number of graphic novels and comic books that depict mental illness, some of which might be like Mom's Cancer by Brian Fies, which is written about a family's struggle in navigating their mother's metastatic cancer. There's also been recent scholarship and comic books around COVID-19. So COVID Chronicles, a comics anthology, is one that was written. And there's also, the CF diaries that talk about Andrew Guthries and his lived experiences with cystic fibrosis. And there are many others. The visual depiction of illness through comics can help with that illness script that we're taught in medical school. We always learn about these kind of like schemata of illness. What is the illness script? What are the clinical signs, the presentation? And we make a link between what the patient tells us, what they look like, labs, imaging, right? And, this being able to know illness through comics builds upon that narrative, being more inclusive of a patient's experience. Some illness might be visible, some might be sometimes visible to the eye, or sometimes it's completely invisible. Like psychological suffering might not be readily visible to the eye, but through the iconography of illness, we are able to bring that invisible and make it visible. And there's that flexibility of this art form to do so. An example here is Marbles by Ellen Forney. And this is a graphic account of her own experiences with bipolar disorder and navigating her desire for creativity while also trying to stay well. And you can see in these images that while manic, there's this symbolism in her face, there's a sword above her, there's the stars, and when in a deep depression, she really draws herself into the sofa in this fetal position, wrapped in a blanket, hiding from the world. I think Dr. Williams makes a really great point when talking about how we represent illness through comics, because he says that, we have, as healthcare professionals, we have this very highly specialized and technical language through textbooks and guidelines and discussions. And that sort of builds upon the official language that is agreed upon by authority. It's peer reviewed, it's objective, it's evidence-based. And it's through those avenues that the discourse really gets its power. We see kind of even through those texts, images will be very curated, right? We are seeing what is normal, what is abnormal. Things might be positioned neutrally and anatomically correct. We might have things cropped and labeled, and it is presented in a very certain way. But graphic memoirs, on the other hand, really stem from a desire for self-expression and might at times challenge sort of accepted medical authority on kind of the perception of illness. And so this kind of unofficial representation can provide new ways in which we think about disease and really deliver some raw truths about lived experiences of illness. Now, let's talk briefly about the depiction of mental illness through comics. These are just a small handful that I've listed here, but I just wanted to show you some of these. I've read a good handful of these. But Justin Green, he was an American cartoonist, and he was an example of a storyteller who shares really profound and vulnerable experience of having obsessive compulsive disorder through his comic book, which is called Binky Brown Meets the Holy Virgin Mary, and that was in 1972. And what it really does is it details the religious quality of his OCD. Then we also see psychiatric tales on here, 11 graphic stories about mental illness, and that was written by Daryl Cunningham, and he presents a series of stories about psychiatric illness from his perspective, having worked on a psychiatric ward. There's also Marbles, Mania, Depression, Michelangelo, and Me by Ellen Forney. And this is the one that was in the previous slide where she's detailing her experience with bipolar disorder. Another one is Lighter Than My Shadow in the left corner by Katie Green. This is a graphic novel about her struggle with an eating disorder, sexual trauma, and her recovery. Now, we also see that comics have fantastic utility in medical education. So Dr. Michael Green is another leader in graphic medicine, and he has facilitated a course for fourth-year medical students that aims to teach medical students to read medically related comics and to be able to create an original comic based on a meaningful medical experience. And what he's noticed about this practice is that it helps medical students reflect on their own professional identity formation. And so when he did pre and post assessments of 42 students, there was noted to be significant improvement in empathy, communication, clinical reasoning, writing, attention to nonverbal cues, and awareness of physician bias. There was another piece of writing from him that noticed that there's actually quite a lot of horror imagery that is commonly utilized as a genre by medical students to depict experiences in medical education. And even just recognizing that really lends itself to asking important questions about medical culture and dehumanization. And then we think about how we can use comics to support medical curriculum. And comics themselves like we've talked about, have a skill required to them where you stitch pictures and text and gutters and time and space and point of view to complete a story and build a narrative. And that can be an illness narrative. And doing so, being able to use comics to create that illness narrative does require experience, skill, and knowledge to make it coherent. There is also thematic relevance that through comics, you can teach empathy, you can help identify emotions, help with perspective taking, looking at verbal and nonverbal cues. And you learn about doctoring. How do you communicate with patients? How do you deliver bad news? How do you teach? How do you provide psychoed? And so the values of using comics in medical curriculum is endless. And I could talk about this for quite a while, but I think it's just really powerful to note that making comics can help with communication skills and help make meaning. And that medical school can be so mind-numbing in many, many ways that there's this perception that medical students are just these vessels of knowledge, right? But I think that what's really fantastic is this shifts that power dynamic to saying that medical students have stories to tell, they can creatively express themselves, and they can make decisions about stories. And so there's also this important piece of helping medical students maybe expose aspects of that hidden curriculum in medical education as well. Listed here, just for your reference, are just some other graphic novels that you can take a look at depending on what topic you're interested in, but this is just a list for your reference. And now what we're going to do is, gosh, we are going to be in this last stage of this presentation. So what have we done? We are going to be talking about future considerations, but we've gotten there through a journey. So we've looked at narrative-based therapies and outcomes. We then considered the role of art and the utility of art. We used both of those to think about comics and how we interact with comics and where comics came from. And then we looked at graphic medicine and how graphic medicine and psychiatry relate to one another and what are some ways in which we can think through that. And now what we're going to do is think about individual strategies for implementation, and then we're going to discuss systemic strategies. So while narrative-based interventions are often in the written word, the use of comics can be used to emphasize and deconstruct problems and past events and the overall processing of internalized narratives, as that makes it actually a very tangible, strengths-oriented opportunity to explore complex narratives and identify special skills and ultimately help reauthor stories. And so we see that being providing great leverage for use in individual therapies as well as group therapies. Now, I think another important piece is that graphic novels can support comprehension for youth who may have literacy challenges. And I think this is particularly important for as we think about applying this to more vulnerable populations, including justice involved youth and youth with multi-system involvement, given the known disruptions and disparities in educational attainment. There's also opportunity to use comics for psychoeducation. We can use it to educate patients and families about diagnoses and treatment interventions. And one of my colleagues and friends from OHSU, Dr. Craig Usher, has created short comics for use in the early psychosis intervention program. And he uses those comics in that setting to provide education about diagnosis and symptoms and intervention. And I think graphic medicine, we've also seen it used in other powerful ways, that it can help with training medical staff. It can help with kind of being able to critically evaluate one's profession. It can help with community education. It also can be a form of peer support. Now, there's also tremendous opportunity for implementation for the use of advocacy. And this is particularly important as we think about utilizing comics for expressing the lived experiences of underrepresented individuals and communities. We see increasing representation through characters such as Ironheart, Black Panther, America Chavez, and Nubia. And coinciding with this is that there are more writers and artists of color being represented in comics, and the time is now. LA Times, New York Times have had several articles about this in the last couple of years about this movement. And just from a historical perspective, we've seen really profound representation of civil rights history captured in comics, and that has created a platform for comics to speak about race and social justice. An example of this is Martin Luther King and the Montgomery Story. It's a 16-page comic that was published in 1957. It was written about MLK and Rosa Parks and the Montgomery bus boycott. And this really helped that story reach a much wider audience and to teach about nonviolent resistance as a tool for social change. And March is an autobiographical graphic novel trilogy by the perspective of John Lewis. And John Lewis utilized comics to, again, detail the discipline of nonviolence and activism and the need for moral courage, and to help inspire future generations in their pursuit of justice. Well, how do we use comics to think about health justice? And these are just some examples here. But because, the comics medium provides a different perspective taking, it really texturizes storytelling, there's this opportunity to use that platform to recognize the dimensional nature of structural determinants of health and intersectional identities. I have included some written here by health co-workers about COVID-19 as a form of health justice. So there's the two articles on the left. There's also an upcoming release of a publication called Graphic Public Health. It's shown on this slide. That is going to be a piece of work that demonstrates sort of the wide range of potential of comics to address topics such as promoting immunizations and outbreaks and gun violence and addiction and climate change. And we see comics utilized for health justice in thinking about disabilities, gender and sexual identity, environment, war, representation of immigration and displaced populations as well. So now that we've envisioned just some of the ways in which we can utilize comics on an individual level, let's consider sort of more systemic implementation and what that might look like. Based on our conversation today, we know that there's obvious utility in medical education, and including comics really warrants consideration in that aspect. I think it's important that there is early and routine introduction to narrative medicine during medical education. And I think one of the most important things is treating narrative-based therapies and art-based therapies as part of the pedagogy of non-pharmacologic interventions that are often underutilized. And I think these are types of interventions that should be leveraged more, and it's really not embedded as a core therapy being taught in medical education. And I think it's important to ask why and think about in what ways could we do that. And so I think both introduction to narrative medicine as well as introduction to the field of graphic medicine would be particularly important to doing so and finding community in that form of expression. Potentially most importantly, in thinking about systemic implementation is the opportunity represented by collaboration with community-based organizations to develop community-driven and community-informed narrative-based interventions. some local organizations are listed here. And I have been working closely with Inside Out Writers over the past year to develop a program for formerly incarcerated youth and adults to explore narrative through comics. The mission of Inside Out Writers is to reduce juvenile recidivism by providing sort of a range of services that includes providing writing groups for currently incarcerated youth, as well as upon exiting incarceration, there also is a reintegration program that provides case management as well as narrative-based services. But the important piece here is thinking about, well, who in my community is offering sort of creative expression to a population I'm interested in working with. The ones here listed here, Inside Out Writers leans into writing, street poets, and Get Lit, or into spoken word. And these are just some quick examples to think about. All right, so we've made it. In conclusion, we have noted the central role of narrative in a few different therapies. We've reviewed some of its utility in youth and youth with a history of trauma. We've considered the narratives of justice-involved youth and how narrative-based interventions show opportunity in this population diagnostically. We briefly discussed art-based interventions. We also reviewed how these two areas gave us the stage to talk about comics. We discussed the unique properties of comics, and then we looked at the field of graphic medicine and how this currently manifests in the field of psychiatry. And lastly, we explored the future considerations for the use of narrative-based interventions and the comics medium format, and that includes clinical applications, use in medical education, advocacy, and considerations for systemic implementation. I hope this invites others to consider the use of comics in narrative building. And lastly, I just want to acknowledge the many folks who have been a huge support. So shout out to Inside Out Writers, Jimmy, Rodrigo, and Monica. So grateful for our time dreaming together about narrative-based interventions for systems-involved youth and how to leverage comics to provide authorship. I'm very inspired by your services and your commitment to reducing juvenile recidivism, and I can't wait to keep learning from you. Dr. Bath, Dr. Katioka, you both have been just a tremendous source of support over the past couple of years when it has come to thinking about how to use comics in vulnerable youth. It's really helped me craft this vision and how to work with community-based organizations to bring this to life. So thank you for your endless support. Shout out to Georgia Paris for her illustrations in today's PowerPoint, and then also for our ongoing collaboration together. I'd also like to thank Dr. Mark D'Antonio, who helped me navigate my personal path to working with systems-involved youth, and I'll be forever grateful in watching him be a tremendous advocate for youth who are in endlessly complicated systems. And I'd like to thank my parents who instilled a love for creativity, social justice, and community service. All right, so I'm going to stop share. Okay.
So we do not have any questions in the chat yet. And I just want to commend you on an amazing presentation. And maybe I will just like kick off the discussion to say, like, why don't we learn about any of these forms as part of our training? And so I think when you first approached me about your interest in this area, I was like, yeah, we really need to, this is a gap, you know, and so if we think about treatment needs for all adolescent and child populations, and how we address those with different types of interventions, our training in this area, both I'd say like psychology and psychiatry, is really underdeveloped, and it's just something that, you know, people just wouldn't even know existed potentially, let alone get training in. And so I think that there's a gap, and also that the promise of these type of interventions, really when we think about community engaged, community led, lived experience led, really has a more transformational aspect. So when we think about really the movement towards strength-based interventions, this really sort of draws on the strength by using the storytelling. So that would be my sort of 2 cents, but I'm so glad that you're centering this for us. And I really look forward to actually in your, you know, future grown-up doctor self doing more scholarship to educate people about this and make this part of our, ACGME requirements to learn about these different types of interventions. So thanks.
Yes, of course, my pleasure. I think it's a great point that, sometimes narrative medicine is kind of sidelined to an interest group in medical school. And I think the same thing. I didn't know about graphic medicine until much later on. It's not something that's talked about. I think it can be so empowering to know that there's other people who want to be creative too and tell our stories in this way. And most of the time, we're not alone. Most of the time, we're not alone in wanting to tell a story this way.
So there's a question from Dr. Katioka that came in. So with COVID, gun violence, racism, and more, and all that our trainees have been experiencing, I'm wondering and dreaming about how to incorporate comic narrative therapy in supporting our trainees. Any thoughts?
Yes, I love that idea. Thank you so much for the question. It really has me thinking about what can be empowering ways of storytelling, and sometimes that is through process groups of of written expression, verbal expression. But I think creating an opportunity in those groups to draw, to imagine, to tell a story, right? Like we have very delineated and accessible ways of thinking about these traumas in our community. But the reality is that some part of the trauma too is the visual representation we see in the media, online, from people we know, and what we do digest as, internally through thoughts and feelings, what we read. There's also this very visual representation of loss and tragedy and sadness and violence. That is part of this trauma too. And so I would think actually it'd be incredibly wonderful to run a group with trainees with a few prompts and try writing short comics as a group. And there can be very structured ways of do this, but usually it would involve, creating a community agreement, creating a safe space first, and then we think about, well, let's try practicing telling a story through comics. Well, let's try representing our feelings, our thoughts, our experiences through comics too. And that can happen in an hour, once a week. It can happen.
Thank you. So a question from Dr. McCracken. Loved your talk. Do you think that comic therapy might help bridge linguistic barriers?
I think so. I think that's what makes it accessible is that, we all have minds that look at panels and comics and assign sequence and assign meaning to visual representation. And part of comics doesn't have to be about the text. A large part of comics can be about the visual. And so when we think about kind of the linguistic barriers, it truly creates an accessible form of expression just through the visual representation, the visual depiction of illness, the visual depiction of emotion, the reality that we identify with the characters that are depicted in comics. It allows us to step outside ourselves and to just follow a visual. And there also are comics in other languages. I'm currently reading a comic by a Japanese writer. It's a graphic novel by a Japanese writer, and it's fascinating to think about even the cultural differences represented in comics and how that can also be a very empowering tool for individuals with different cultural backgrounds to seeing themselves represented in a story.
This is with my parent hat on, but I remember my daughter really gravitated towards graphic novels, and not being someone who grew up like with them being, in libraries and an acceptable thing to read. I was like, speed dial to the librarian. I'm like, what's up with all these graphic novels, but I got really educated on how critical they are, and they offer a lot of depth and nuance. And just because they're graphic, I think we have this bias, right, against like graphic novels in general, and thinking that they may not be as serious or explore things as deeply. And it's really, the field of that has just really grown tremendously.
Yeah, it has grown tremendously. And I think that, like kind of in my talk, I mentioned how so much of talking about comics is spent justifying them. And I think there's such opportunity if we recognize the power of comics to move forward and really start thinking about its platform to tell stories, it's tremendous. And I have, if we look at like, this one's like John Lewis's book, right? So this one's John Lewis's book. But he leveraged this early on with a trilogy, and being able to write and tell a story in this way doesn't require significant expertise, but it just requires a message and a story to tell. And he I think really embodies kind of the ability to use this, what can be thought of as a very devalued platform in a very sophisticated way to make some really powerful messaging about civil rights. And so
I love how you highlighted the history of it being used in the civil rights and other social justice movements, and that might even be something that, like, building on Dr. Katioka's comment on how maybe for trainees who are interested in activism and grappling with all of the different things going on, including the recent shootings, like, could graphic medicine maybe be part of that story? Okay, well, we have no more questions. Thank you so much, Dr. Espana.
Thank you so much.
Great to know you. Yeah.
Appreciate your time. Thank you, everyone, for joining.
Thanks, everyone.